Thanks, everyone, and thanks for the invitation today. In addition to covering the part of the hematological malignancies, I also cover breast, palliative care, and GI, part of the GI services at Penn Medicine. The CDCES stands for Certified Diabetes Clinical Education Specialist, in addition to my oncology background. I've been with Penn for about 10 years now. So I just want to kind of give a synopsis of our services that we provide at Penn. We use an evidence-based model for medical nutrition therapy. Our main emphasis with patients is really to help with nutrition impact symptoms. You'll hear me say a lot, maintaining weight through treatment is our goal. I think you all know that there is very little research out there with aplastic anemia or MDS or MPM and nutrition-related recommendations. So we really focus in on helping you get through therapy, improving your tolerance to therapy as well. And we do offer some limited support for survivorship as well. From a personal level, I'm a breast cancer survivor, 6 years out. And so I've been very involved in the cancer community. If you're local, the Breakthrough Bike Challenge fundraises for Penn. So we do a 12, 25, and 50-mile ride. Do I need to stop?
Very good.
Okay. Yeah, the second Sunday of the month, and I'm in the Radiation Oncology Beam of Life team. I do 12 miles. Been doing that since 2018. I joined a Week in Row survivorship group here in Conshohocken. That is a national group. I'm on a national committee trying to expand to other cancer survivors, teaching people how to scull and row. And then finally, in January, I want to be a vet before a dietitian. So I got my dog therapy certified, and through the Hospital of the University of Pennsylvania Pet Therapy Hups Pups program, we visit patients either in the hospital during infusions or down in radiation oncology. And yesterday, she was a big help. I'm not sure if you heard, but our electronic medical record went down. So lots of frustrated patients who couldn't get their treatments, and a lot of staff that didn't have a lot to do. So she spent a lot of time giving hugs and kisses to everybody. Yeah. So what were we going to talk about here? You're going to hear, if you don't get anything out of the presentation, and the importance of maintaining weight and muscle mass during treatment is critically important. Unfortunately, any type of weight loss with cancer causes muscle mass loss first, with retention of fat mass, a condition called sarcopenia. And so that can make it much more difficult to tolerate treatments. So we'll talk about those nutrition tips for side effects with treatment. And then just briefly, just one slide for nutrition tips for survivorship and beyond. Okay. So I'm going to skip this slide. My disclaimer, I can only talk about general nutrition information. You should really check in with your oncology team for a referral to a dietitian. And for those of you not within the Penn system, I will have some resources to find a dietitian at the end of my presentation. So we'll be talking about first nutrition and fluid needs, calorie and protein, and then balancing that out with the fats and carbohydrates before going on to the common tips for nutrition symptom management and what is a cancer protective diet. Next slide. Okay, if you've been in the Philadelphia area, or I think many surrounding areas, even if you're not going through active cancer treatments, it's been ridiculously hot in the humidity levels. So dehydration is common with people even without going through cancer treatments. We know that our body is 2/3 water, and we estimate fluid needs based on your weight in kilos. So that's about 30 to 35 calories per kilo are the recommendations for fluid needs. Certainly many of the nutrition impact symptoms, headaches, dizziness, weakness, fatigue, nausea, constipation, and even irritability are some of the signs of dehydration. Excessive vomiting and diarrhea can further exacerbate fluid needs. So really important in some instances, especially with excessive diarrhea, to replete with electrolytes as well. So for a 45 to 54 kilo person, about 120 to 140, that's about 6 8-ounce cups of fluid per day. But as your weight gains, the highest range, 135 kilos, about 300 pounds, it's about double, about 16 8-ounce cups of fluid per day in order to meet your, to prevent dehydration. Next slide. Oh, can I do it? It's not working?
No, I just
Sorry. Okay, so you're just going to hang with me?
for now. Yeah, I just got to make that bar at the top. go.
Okay, so in general, we use about 8-ounce cups, 64 ounces of fluid. That's about 4 of those 16 and a half bottles of water, which is about half a gallon or 2,000 mLs, roughly 2,000 mLs. This, the full gallon, 4 quarts, 8 pints, 16 8-ounce cups is for that 300-pound individual. And we also use, for each calorie, that's an equivalent 1-to-1. So 2,000 calories will be about 2,000 mLs. No. Oh, there, it's advancing. For people that are trying to maintain weight or really struggling, remember that anything that melts at room temperature is considered a fluid. So if you need to get electrolytes in from things like Gatorade or coconut water, or think about juices, soups, milk, nutritional drinks like Boost or Ensure, ice cream, water ice, all of those count as your fluid recommendations. Even soft foods like puddings and yogurts, also 2/3 of that will be the equivalent of your fluid needs. So those with early satiety or difficulty getting full quickly, I often recommend these types of foods to get both fluid and calorie needs. So anywhere from 60 to 500 calories based on what you're consuming. When estimating calorie needs, we again use a formula, a pretty wide range, 20 to 35 calories per kilo. So if we're using a 150-pound individual, and there's 2.2 pounds for every kilo. So we divide that by 2.2 to give us 68 kilos. And with that 20 to 135 range, that gives us roughly 1,400 to 2,400 calories per day. So if you are in survivorship, don't have issues with losing weight, we might go at the lower range. Certainly post-transplant within that first 3 months, we might go at that higher 35 calorie per kilo range, and sometimes even higher if there's a lot of weight loss going on. I caution you with the use of some of the online calculators. Although I love the MyFitnessPal app, which is a free app, downloadable app to help estimate if you're meeting your calorie and protein needs, it often underestimates. So if you're trying to gain weight, then you want to use something like the calorie counter or the formula that I provided. But if you want to see if once you've established your calorie and protein needs, whether or not you're meeting them, then the MyFitnessPal is a great option, WebMD as well. My personal favorite, chronometer.com, you sign up, you don't have to pay for the general version, will also estimate calorie, protein, and vitamin mineral needs as well. Protein, really important. We know it's the building block of our muscles. Also can help build those blood cells. I think you all know that if we were to try to replete iron, we certainly wouldn't be able to do it with nutrition alone. I can give you all the iron-rich foods. We know that your condition is a bone marrow failure disorder, and that's not going to really make an impact. But balancing calories and protein, I think, are really important. Some people forget that calories are important in muscle maintenance as well. So some people will use the really high protein drinks like the Premier Protein, Ensure Super High Protein, 30 grams of protein, but only 160 calories. So I like the balance of Boost Plus or Ensure Plus, which is closer to 350 and about 15 grams of protein for people trying to maintain their weight. I do tell people to try and build protein into each of your meals, especially if you have blood sugar fluctuations or with steroids that can cause imbalances in the blood sugar, and then add on calories with fat first and then carbohydrates. Our sources of protein: meat, fish, poultry, dairy, soy products like tofu, tempeh, soy milk are considered complete proteins. Soy milk and dairy milk are the same, about 12 grams of protein per serving. When you get into some of these plant-based proteins like almond milk, oat milk, they're fairly low in protein. So take a look at that if you're using those as substitutes. Nuts, seeds, beans, legumes are vegan sources of protein. They need to be balanced with whole grains for complete proteins. The requirements, similar, 0.8 to 1.5 grams per kilo. So for that same 150-pound individual, 68 kilograms, 0.8 to 1.5 grams. Again, a pretty wide range, gives us about 54 to 102 grams. 0.8 grams I usually only use for people in survivorship. That first 3 months after transplant, we use about 1.3 to 1.5 grams, so closer to the 100-gram range for someone who is in that particular stage of their cancer journey. Quick and dirty method: divide your weight by half and then use the estimation based on where you're at. So for that same 150-pound individuals, that's 75 kilograms. I often get questions on what is a portion size of protein. Meat, fish, poultry, the size of the palm of your hand without your fingers and thumb, that's about 3 ounces, or the size of a deck of cards. That's about 20 grams of protein. Use your whole hand, and that's more like a 4-ounce portion, about 30 grams of protein. An 8-ounce cup of dairy or soy milk is about 12 grams of protein. 2 eggs, 4 tablespoons, 2 tablespoons of nut butter, I should say. 5 tablespoons of beans, or half a tin, is about 15 grams of protein. So if that same 75 kilogram individual at 1 gram per kilo, about 75 grams protein, 2 servings of the 4 ounces for lunch and dinner. You can add 2 eggs to get your 75 grams in. If you don't like eggs, then you could do 2 tablespoons of nut butter with your breakfast on toast, and then maybe add in a snack of yogurt to get that other 12 grams in there. Greek yogurt usually is about 18 to 20 grams. So if you're really struggling, that's a really good way to get it in. Inclusion of healthy fats next, especially if you're trying to balance your blood sugars. I'll say protein first and then fat, because you're going to get 2.5 times as many calories in the fats. If you're really struggling with your weight, your oncologist will probably say, eat whatever you can. Add butter, oils, sauces, gravies. Think about a Alfredo sauce with a heavy whipping cream. You can use Haagen-Dazs or Ben & Jerry's. They're probably the highest fat ice creams around, so you can add those to your smoothies. If you're more at survivorship and you're trying to use healthier fats, the monounsaturated and omega-3 fatty acids are the best way to get those for heart health. That's your canola, olive oil, avocado. You can also use avocado in your smoothie. It gives a nice creamy consistency and will just take up whatever flavor of the fruit that you're adding into that smoothie. We know that our omega-3 fatty acids are rich in fish, salmon, Atlantic mackerel, anchovy, sardines, herring, white chunk tuna are our richest sources of omega-3 fatty acid. Plant-based sources of omega-3 include walnuts, flax, pumpkin seed, hemp. So those could be substituted as well to get fat in there. And then once you've added in your starchy foods, bread, cereals, pasta, rice, potatoes, beans, chestnuts are higher in carbohydrate than other types of nuts to add in, and thinking about balancing blood sugar if your blood sugars are fluctuating with steroid use. Okay, well, next move on for some of the tips for nutrition symptom management. And I couldn't cover all of them in our time today, so I thought I'd focus on nausea and vomiting, constipation, diarrhea, poor appetite, or the feeling of fullness too quickly, especially if you have a swollen spleen that can really impact the ability to eat a lot at one time. And taste changes. So we'll kind of put in some tips for dry mouth or mouth sores into the taste changes as well. A word on food safety. I think if you're neutropenic, you've probably been told this before. The FDA has come up with new guidelines for cancer patients and post-transplant patients, especially in that 3 months post-transplant, or even with chronic graft versus host disease. I've had some patients that have some foodborne illnesses in relationship to that as well. So you need to use caution in those particular situations. So the FDA has classified low risk versus high risk foods in these categories. So that is critically important when your blood counts are really low, and that 3 month post-transplant to avoid the high risk foods. So meat and poultry should be cooked to an internal temperature of 165 degrees, fish 145 degrees. So no raw fish, no sushi at this time. Even something like a tuna tartare is considered raw. Smoked fish like lox would be considered high risk after transplant. And your burgers should be well done. Steak should be cooked to the medium. So we don't want any pink juices during this critical time. All dairy products should be pasteurized, so no raw milk or no, some of the European cheeses are unpasteurized, so look for pasteurized on the label. There's similar recommendations to those that are going through pregnancy, avoiding a lot of the soft cheeses like brie and camembert, anything with blue vein mold in them can be particularly concerning. Even queso fresco and some of the feta cheeses, if they come directly from Greece, can be unpasteurized as well. Sprouts, alfalfa sprouts, Brussels, or any kind of broccoli sprouts, they're fermented at room temperature, and they're the number one cause of foodborne illness, even in elderly healthy individuals without cancer. So if you're going to use them, then cook them into a dish. So sometimes I see them in stir fries and Asian cuisine, but if they're on a salad bar, I'd stay away from them. Obviously, that 3 month post-transplant, or if you're neutropenic, you need to stay away from salad bars at that stage in time. Vegetables and fruits should be well washed. There is no evidence to suggest a vegetable spray is superior to using maybe a scrubbing brush. Sometimes getting some soil off of the outside of a mushroom might require a little bit of extra effort. But really, the only thing that is concerning if you're neutropenic or post-transplant are berries. It's really hard to get into those crevices. So cooked berries only, no fresh or frozen berries during that period of time. The last one is hot dogs, luncheon meats, deli meats need to be reheated. So usually 1 minute is enough in the microwave to make them safe to eat. If you live in an area where well water is your common source, then you might need to get that tested to see if there's any kind of microorganisms in there. And then again, staying away from deli salads in the grocery store. Leftovers should be discarded within 3 to 4 days. If you are going to be undergoing a transplant, you also want to look at all the condiments in your fridge. You might need to just throw them all out. I know I have some ketchup that I don't usually use I don't remember when I bought it. So all of those things should be discarded and started afresh after in preparation for a transplant as you're going home. Fresh uncooked meats. When I go visit my father, who's 94, his refrigerator is a science microbiology experiment. I have to clean out his fridge before I eat there. So I don't know. He doesn't remember when that food that his girlfriend gave him was put in there, and it's usually got some beautiful color, blue and black mold on there. So in general, fresh uncooked meats, 1 to 3 days in the refrigerator. If you're not going to use them, freeze them. Left meat and poultry in the freezer 3 to 6 months. Fish, because of the unsaturated fats, only 1 to 2 months in the freezer. So think about those things if you're going to have a transplant. Nausea and vomiting. Intractable vomiting, where you're vomiting more than 2 to 3 times per day, you're unable to hold down solids or liquids. That's an emergency situation. Nutrition's not going to fix something like that. We work really closely with the oncology team to make sure you have anti-nausea medications on board and use them as prescribed. So try and get ahead of the nausea before it becomes too difficult to manage and leads to vomiting. So if it's every 8 hours, can you maximize with another agent in between? And that's kind of the first step that we'll really look at. We know that dehydration can also be a concern with nausea. If you've been pregnant and had nausea, you may be more prone to nausea throughout treatment. So you probably remember that it's worse in the morning, separating your solids and liquids. So maybe some dry toast or crackers first thing in the morning. There's a lot of saliva with nausea before it goes into overt vomiting. And so maybe waiting an hour, 30 minutes to an hour before you have that liquid food. Odors can also cause a lot of nausea. So sometimes we recommend people think about foods that can be served at room temperature, a cold cereal versus a hot cereal, maybe a chicken salad instead of cooking the poultry. Red meats emit a lot of odor, and that can really be off-putting if you're having a lot of nausea symptoms. So try to eat in well-ventilated areas. Maybe the rest of the family can cook their burgers outside, so you don't have to be exposed to that. And ginger tea is really helpful. It kind of slows the gut response, the motility of the gut, and so it can be very effective as well. And that can be soothing. In our cancer center, we use ginger and peppermint aromatherapy for nausea. So lots of great foods that you can use. Ice chips, brown rice, applesauce, chicken broth. Coconut water is a great electrolyte replacement. Just add a pinch of salt in there. Gatorade or Pedialyte are also helpful for nausea, especially if there's a lot of vomiting going on, to replete electrolytes that are lost during that time period. We'll talk about the brat diet: bananas, rice, applesauce, and white toast, mashed potatoes, watermelon, ginger. If you're not familiar with the cookbook, The Cancer Fighting Kitchen by Rebecca Katz, it's one of my favorites. She has all sorts of ways to incorporate ginger, whether into smoothies, into other stews, soups, as well as the recipe for ginger tea that I alluded to earlier. Constipation. Again, dehydration can lead to constipation. Regular bowel movements are anywhere from 3 per day to 3 per week. Everybody has a different constitution. So of course, some of the anti-nausea medications can exacerbate constipation. And if you're really constipated, that can lead to nausea. So it's kind of an endless circle here that can lead to that. Recommendations for healthy people would be high fiber, whole grains, beans, legumes, nuts, and seeds. But if you're on any kind of pain medications, an opioid like oxycodone, that can actually really slow the gut motility and actually can lead to an obstruction if you use too much fiber. So really, fluids is what we recommend number one. And then an old nurse friend of mine mentioned the mush and push theory. Anyone heard of that one before? No? Okay, so mush is soften the stool with a stool softener like Ducalax, especially if you feel like you have incomplete evacuation of stool. And then the push is the laxative. So that's the Miralax or the Senna. Those two in combination are often used to help with constipation symptoms, but you need fluids for the laxative portion of that. Some people will mix a warmed prune juice in with the Miralax. That helps relax the bowel a little bit, get things moving, or go for a walk, even just around the house if you're not feeling well, in order to help stimulate that bowel. Okay. Okay, diarrhea can be another side effect. Some of the treatments that might be occurring, it might be masking a foodborne illness. More than 3 loose stools per day you can lose a lot of electrolytes. Potassium chloride, magnesium are the common ones that are lost. So in addition to fluid, you might need 8 to 16 ounces additional electrolyte replacement, whether it's that coconut water with a pinch of salt or whatever works for you. Gatorade, Pedialyte, Drip Drop. There's so many different products on the market. As with nausea, small, more frequent meals, avoid greasy or spicy foods because they can exacerbate things. There are 2 types of fiber, the insoluble and soluble fiber. Insoluble fiber are those whole grains, bran, beans, legumes, nuts, and seeds, and they actually act like a broom to push things through. So you want to avoid any type of bread with a whole grain fiber or some of those breads with nuts and seeds on them. Soluble fiber on the opposite side of the spectrum, things like barley, white rice, oatmeal, that actually can help slow that gut movement. So constipation, things are moving too slow. Diarrhea, things are moving too fast. Not enough time to help reabsorb that water. So psyllium fiber is considered a soluble fiber, and it helps kind of gel those stools so that you can have time to pull the water out and you have more formed stools. And then some people may become lactose intolerant, so dairy products may be an issue with diarrhea as well. So you probably heard of brat, the banana, rice, applesauce, and toast. People often will follow this for a really long time and forget to add protein. The chicken that was on the salad bar today, very bland, very easy to digest, or white fish like cod, tilapia, flounder can be well tolerated, whether having nausea or diarrhea. So don't forget to add in some kind of protein source when you're experiencing these types of symptoms. Associated with diarrhea, some people will also have gas and bloating, either burping, that's more upper digestive tract gas, or flatulence, lower digestive gas. So the gas-forming vegetables from the cabbage family are really notorious for diarrhea, gas, bloating. So you may have to stay away from all the healthy ones like broccoli and cauliflower and Brussels sprouts, arugula, kale, kind of opposite to what a healthy cancer protective diet might be if you're experiencing these kinds of symptoms. High fructose foods, so concentrated regular soda or juices, you might have to dilute them if you're having a lot of diarrhea. can be a concern. And some of the major fruits that are high in fructose are dates, beets, that's a vegetable, but pears are really high in fructose. The skin of the apple specifically, and even things like onion and garlic. I saw that on the salad bar as well. If you're having a lot of gas and bloating, you'd probably want to stay away from onion and garlic as well. Poor appetite is common with patients after transplant. They lose a lot of interest in food. Maybe they're not as hungry. So it's really important to kind of maximize when the best part of the day is. Again, you might, instead of 3 square meals, 6 to 8 little meals. I often tell people to set timers on their watch in order to get those meals in. Even if it's just 2 ounces at a time, that's going to help with meeting those nutritional needs. And you need to get more bang for your buck here. So to get your fluid needs, some of those high calorie beverages that we discussed, like a cream-based soup, a shake, a nutritional drink, all of those things can be really helpful. Try a little bit of physical activity before your meals, schedule those meals. Maybe at nighttime, you're going to bed earlier than you were accustomed to. And so a heavy meal at dinner time might not be suitable. So like the Europeans, maybe your heaviest meal will be at lunchtime or your breakfast meal when you're most likely to have an appetite. Some of these recommendations are similar if you're the early satiety. I notice this a lot when patients have a really enlarged spleen. It can compress many of the parts of the digestive tract, sit on the diaphragm, so they can't eat a lot at one time. I just had someone last week with MPM who had this experience. So we got him approved for 5 nutritional drinks. The Boost very high calories, about 520 or 22 grams of protein. So insurance doesn't always cover that one, but that can be helpful. Think about adding peanut butter or yogurt or cottage cheese or a protein powder to a shake in order to maximize the calories in every bite that you chew, so you don't have to get as many calories in one setting. Taste changes. Okay, good. So this is one of the most challenging things that we face with trying to find things that work for patients once they experience taste changes. This is really common immediately post-transplant that we see, especially if there's mouth sores going on. Many of the chemotherapy agents will cause a metallic taste, like those listed here. Cyclophosphamide, doxorubicin, the 5-fluorouracil, methotrexate. Cisplatin is probably the worst in terms of causing a metallic taste to foods. And oftentimes there's high iron content in red meat. Meat and pork are red meat. Unlike the advertising, pork is not the other white meat. It has a much higher iron content than poultry and fish. So those are the first things to go with people that are accustomed to kind of like meat and potato meal. They can no longer get as much protein from those foods. So we often will tell people to try and substitute with poultry and fish, using marinades to mask the tastes of many different foods. And sometimes there really are only 5 tastes: are sweet, sour, salty, bitter, and then umami, the 5th taste, which is the reason that we pair grapes with cheese. It's that sweet and sour combination. And that umami flavor profile, they use it a lot in Asian cooking. The sweet and sour marinades that they use can really help mask many of these taste changes. So the more specific you can be in some of these taste changes with your oncology team can help them identify some tips for improving those flavor profiles. Sometimes it can be an odor perception. Again, with nausea, eating those foods at room temperature, well-ventilated areas can be helpful. It's more of an odor perception. In this book, Cooking for Chemo by Ryan Callahan, he talks about using a nose clip when eating certain foods. I actually taught food science and I use this technique with one of my classes. I had students use nose clips, drink cow milk and goat milk and see if they could perceive any flavor difference. They could not. As soon as they took off the nose clip, they described the goat milk as grassy, terpenes, awful. So that can be something that you can try and experiment with because it could be contributing to some of the taste changes that you're experiencing. There really isn't a whole lot of research in taste changes and cancer treatments. We have the Monell Chemical Senses and Taste Center here in Philadelphia. They've identified some genes for people that have a heightened gene that perceives bitter taste, and that may be something that is exacerbated during certain cancer treatments. I'm actually a taster, so they call it a taster versus a non-taster. The people with the perception of bitter are called the tasters. My husband's a non-taster. He can eat all the broccoli I put in front of him. I actually have to put a drizzle of honey because even though I know it's so good for me, I really don't like broccoli. So I have to trick myself to do that. And so a lot of these systems, the FAST system talks about fats, alcohol, salt, and sweet. And so using the different flavor profiles in order to trick the taste buds into accepting more kinds of different foods. So if things are super sweet or salty, if you have no mouth sores, then you can add some lemon juice. That balsamic vinegar dressing as a marinade would be a good adjunct for that. If you do have mouth sores, then adding fat, like something like a cream cheese or butter, oils to a food, using marinades are really helpful in this context. If things are too metallic or too bitter, sweet masks this. I mentioned already the honey on the broccoli. I also have used maple syrup. Maple syrup's used as a glaze a lot with fish to help improve the flavor profile. If things are too bland, think about some of the soy sauces or oyster sauces to jazz things up a little bit. Too spicy, again, using fat as well in order to help improve the flavor profile. With severe taste changes, I do tell people to use a baking soda salt rinse before each meal in a quart of water or 4 cups, 1 teaspoon of salt, 1 teaspoon of baking soda, and use that as a mouthwash before every meal and before bedtime. For dry mouth, mint is particularly cooling. So think about Indian culture. They use mint to cool down a lot of their hot, spicy foods. Biotin, which is a over-the-counter mouthwash without any alcohol, is often recommended for dry mouth. So using mint can be helpful. The base is glycerol and mint. So that's where that kind of theory comes from. We hope to have more research in the future on helping with taste changes. Really, my conversation today is very non-scientific based on some of the other lectures that I saw today. So there isn't a lot of research in this area. Some other tips from that FAST system: portobello mushrooms instead of like a red meat burger. If things are tasting metallic, a little bit of Parmesan cheese. Sweet and sour marinades. You can use orange juice and balsamic vinegar, marinating with meats. I often tell people to try some Asian sweet and sour takeout just to see if that'll work before they start experimenting with cooking. Okay. So my last slide talks about a cancer protective diet. And my go-to resource is the American Institute for Cancer Research. They recommend, very similar to what the American Heart Association recommends, Mediterranean diet, where half of the plate should be from your fruit and vegetables. I really like this one here from the Harvard School of Medicine because they break it out into vegetables having a little bit bigger part of that half plate than fruits, especially if you're struggling with blood sugar control, 3 vegetables, 2 servings of fruit per day as a minimum. You can go more so if you're not struggling with blood glucose control. The other quarter of the plate are your whole grains, at least 3 servings of whole grains, brown rice, quinoa. There's all sorts of whole grain pastas out there made from chickpea, beans, edamame. I've even seen an edamame pasta out there. And then the final quarter of the plate is your healthy protein. So less emphasis on red meat in this situation, more emphasis on those omega-3 fatty acid fish that we talked about earlier. And thinking about water and those monounsaturated fats, the olive, canola, or avocado oil in moderation. Okay, stay hydrated. Yeah, that's it. So in summary, if feeling well, eat across the rainbow. 2/3 of your diet should be from plant-based diet. The example from our lunch was perfect. If you avoided the Philly cheesesteak, there was every component of the lunch menu that I approve. Kudos to the chef or whoever selected the menu. It was very colorful, lots of great things that you could have added in there. During treatment, maintain weight, maintaining that muscle mass. Fluids are really critically important, not only to prevent dehydration, but it also helps flush the chemotherapy out of your system. Maintain your calories and protein and balance them with your carbohydrates and fat. And then seek advice from your health care team early. So, yeah, so some of my resources, we do have a website, the the Abramson Cancer Center has the OncoLink website, which is owned and managed by our radiation oncology department. It's internationally available. This particular one of our former dietitians, protein-packed purees for people with chewing or swallowing issues. Some of these recipes can be really helpful if you end up having mouth sores, where soft foods are usually recommended. The Oncology Dietetic Practice Group also has a lot of really great resources and recipes. For those that are looking for a referral to a registered dietitian in your area, the Leukemia and Lymphoma Society offers free nutrition counseling to patients undergoing cancer treatments. The Academy of Nutrition Dietetic Practice Group for more general nutrition recommendations. You can look on their website and find someone in your area based on your zip code. And then for healthy nutrition resources, survivorship resources, American Institute for Cancer Research or the American Cancer Society has some healthy eating videos. Okay, well, thank you for your attention today. And if you have any questions, I'll entertain them at this time. Thank you.
Thank you so much, Doris. And I'm going to start with a question we have online.
Okay, sure.
It says, is there any information on lipoprotein A and recommendations in types of fats? Does dietary fat affect lipoprotein A?
So lipoprotein A is usually people that have cardiovascular conditions. I'm not a cardiology dietitian, so I would recommend, I don't know if my information is as up to date as the cardiology dietitian would be, but I would say that thinking about the omega-3 fatty acids, so fish at least twice a week, the ones that I talked about, the salmon, the mackerel, the anchovies, sardines, herring, and then the monounsaturated fats. So I think the newest recommendations include mono and polyunsaturated fats, which is olive, canola, avocado. I think it also includes like grapeseed and sunflower or safflower oils as well.
Thank you for that. Questions in the room? What about the neutropenic diet? for patients? What is the thought on the neutropenic diet?
So the FDA did establish new guidelines for people with undergoing cancer treatments that are neutropenic. And after transplant, especially that first 3 months where your immune system is completely depleted. So I did have those 2 slides on food safety that are included in there. So making sure meats are cooked well, avoiding any raw, undercooked products, similar to pregnancy recommendations. I don't know if patients get my slides.
Yes, yes, they'll be available.
Yeah,
Right,
and
thank you.
the link for that is available on that slide as well, so that you can go and look at their full, that's like I think it's like a 25-page booklet that's included in there. And I just kind of highlighted the major tips.
Thank you. And we do have a question online. What are your thoughts about the use of Beano for gas and bloating?
Yeah, that's a great idea. Beano before meals for excessive gas production, especially belching, is really helpful. So yeah, I certainly would recommend that.
Okay. Yep. I will go right over here. Just one moment.
Thanks. On the theme of beans, one of your first slide mentioned dry beans specifically. Is that because canned beans have sugars in them or something? I just wondered why dry was selected.
Probably just the picture file that I found. No,
Oh, okay.
no, not necessarily. No.
So
Right.
beans are beans.
Beans
canned
are
are others.
beans. Yeah.
Thanks.
I'll come right over.
Hi, quick question. What was the comparison on that New American Healthy Plate? There were 2 charts up there. Was there a difference in the amount of vegetables and fruits you suggested?
Oh, right. So for the Healthy Cancer Protective Diet, yeah. So 5 servings of fruits and vegetables is usually a minimum. If you can get, if you have no side effects from your treatment, 8 is goal. I know that's really difficult to follow, but 3 vegetables and 2 fruit servings per day at minimum would be the recommendation.
This is kind of odd, but is there a reason that someone might have excessive salivation? And then is there a causative related to that?
So I've seen it with people with amyloid cancers have a lot of excessive salivation. Sometimes if there's a lot of lymph nodes around the neck area, that can cause excessive salivation. I've also seen it with other medical conditions. I think Parkinson's also has excessive salivation. We usually refer those people to like speech language pathology or dental in order to see if there's, I think there's some drying agents that can be prescribed medically that can help with the excess salivation. I think I've had a patient in the past with a stroke that had like literally had to spit into a cup because there was so much salivation. But fluids, the baking soda salts, we see that a lot with head and neck cancers, excessive salivation as well.
Thank you. Any more questions in the room? Okay. Well, thank you so much, Doris, for sharing your time and your expertise with all of us today.
Thank you for inviting me.